I'm Michele Sternitzky, and I'm Associate Vice President of Nursing. I work predominantly within the Foothills Hospital. However, I do have some areas that I oversee in the clinics as well. I just really want to start off by showing my gratitude to all of you, the community. Our patients and our community have really had an outpouring to our staff and to the team that's working so hard to protect you. So we've received letters to baked goods, to donations to the foundation, and I just really want to recognize that. So thank you all for that. So really my role is working with the leadership team in combination with our infectious disease team. And we've been working around the clock pretty much to ensure that we are following all the latest protocols and safety standards. This started, of course, back in March, and we continue to do this on a daily basis. So we are constantly monitoring the new guidelines that are coming out, both from CDC to OSHA, to also our state guidelines. And we are ensuring that we're keeping up with the latest research as well. And every day we discuss our community numbers and any barriers that we foresee. We are also keeping a very close eye on all of our admitted patients. We're looking at our own COVID-positive patients in-house, and also about how our staff are doing. So tonight, I'm really just going to reiterate what the other physicians have talked about tonight about keeping our patients and staff safe within our doors. So right from the moment that our staff enter the facility, they do the same thing that our patients do. They are screening for symptoms of COVID-19. So they actually have to attest prior to starting their shift that they are symptom-free of COVID-19. In addition, they all receive training on exposure. So they are aware that if they have any type of exposure to someone with COVID-19, they would contact us, and then we do as what Amy was describing. We put them into a quarantine for 14 days and continue to monitor them for symptoms before we would return them to work. So when our staff enter the building, of course, they enter with their mask. And every patient encounter that they have, they are also wearing eye protection. As Amy pointed out, we did adopt this very early on, so all of our staff are actually putting on their mask before they even get to the door. And they wear it entirely throughout their shift, minus their break times. And even during their breaks, we are very careful about our social distancing policies, and we have really minimized congregating areas in the hospital, including our cafeteria. One person per table. Everyone really honors this. This is very important to all of our staff because we want to protect you and each other. So as you can see in this picture here, we have everything from the mask to eye protection to our isolation gown. And putting these on seemed pretty simple. But what I can tell you is there's actually a technique to this, and we've done extensive training with all of our staff throughout the hospital on how to place the gown, the mask, the goggles on safely, and then also remove them very carefully without any kind of contamination. On an annual basis, we also complete infection prevention training. So we do that normally. So this type of equipment is actually normal for us. We handle infectious disease all the time. I will say, of course, we've heightened our use because of COVID-19, so we've gotten even better at using this. And this protective equipment, of course, creates that barrier between our patient and our staff, and really ensures that each encounter that you're having, that your care is very safe, that we are protecting you, and we're also protecting the staff from any germs that may cross over. Our staff in that infection prevention training, they also learn how to do proper hand hygiene. They learn how to disinfect. And also just monitoring for their symptoms and making sure that they are completely symptom-free before they return to work. So on to our cleaning procedures. We follow all of the federal and state guidelines. So CDC, of course, is one of the regulatory agencies that we follow. And we look at the product recommendation list that they have, and that's how we determine which disinfectants to use. We use a lot of checklists, so very similar to a pilot who's getting ready to take off. We go through a very systematic approach every single time so that we do not miss a step. We've really increased the frequency of cleaning all surfaces. We pay very close attention to all high-touch surfaces. So areas like that would be counters, around sinks, doorknobs, any entry and exit point in the building. We also have checklists for our daily patient room cleans and also our procedural surgery areas between every single patient use. Our environmental services staff, so you can see the team there on the screen, and clinicians have been very specially trained in both the personal protective equipment as well as the cleaning techniques. We've also trained them in chemical safety because, of course, with all of these new disinfectants around, we want to make sure that they're handling them safe. So in conclusion, this pandemic has really heightened everyone's awareness of our environment and really providing the best and safest care for you. So now I'm going to share a video from one of our patients during a visit to the Foothills Hospital.
Hi, my name is Kirsten. I'm a resident in Boulder, Colorado, and I'm very pregnant, as you can see, 41 weeks pregnant as of tomorrow, waiting for this baby to come out. And throughout my whole term, I've had no issues and concerns coming to any of either Foothills or currently Erie to get checkups. I feel like the hospitals and clinics are doing a great job making sure everyone's safe and healthy and doing all what they need to do to make sure we stay safe and healthy in these current times.